Hello, my name is Dr. Khan. I am a psychiatrist here in town, and today I'm going to tell you about Parkinson's disease. Parkinson's disease was discovered by James Parkinson's. It is due to degeneration of negrostriatal pathway leading to deficiency of dopamine. That leads to major clinical symptoms like rigidity, echinacea, tremors, and shuffling gait. It has various etiologies, including exposure to toxins, oxidative stress, head trauma, and genetics. The genetics is due to mutation in Parkinson gene, which is chromosome 6, and another chromosome 4, which is for alpha synuclein. Genetic factors when it happens due to mutation, and when there is a mutation, it leads to problem in mitochondrial dysfunctioning, which we can say is due to the cell signaling. And the genetic factors are mostly in 10% of the patients of Parkinson's, and these patients are younger than 45, and when it is due to genetics, the onset is at a younger age, and it is due to mutation in the genes. Otherwise, most of Parkinson's patients are over 65, and it leads to various neurological problems as well as psychiatric issues. I mostly see them with psychiatric issues like depression, psychosis, and other psychosocial issues which come with Parkinson's. So, in clinically, symptoms of Parkinson's disease can be divided into neurological symptoms and psychiatric symptoms. Neurologically, we see these patients with bradykinesia, which is slowing of body movements, tremors, which is typical pill rolling tremors. The, then they can have rigidity. Rigidity can be of various type. One of them is a clasp knife, which means when you try to, just like when you open the knife, initially you will have rigidity, then it leads to, rigidity can be various type, which is beyond this scope of today's discussion. They can have gait problems. Most of these patients have psychiatric problems as well, and which are depression. I commonly treat depression with Wellbutrin, which increases dopamine, as well as it treats the antidepressant depressive symptoms. Dementia, psychosis, and depression. These are most common psychiatric manifestations of Parkinson's disease we treat. I want to emphasize the difference between Parkinson's disease and Parkinsonism. Parkinsonism is a syndrome which I see it every day in my practice, is due to the antipsychotics we use. And when the patient has bradykinesia, tremors, rigidity, due to blockage of dopamine, due to antipsychotics, that's Parkinsonism. And Parkinson's disease is different. So, and the main hypothesis is same. In Parkinson's disease, there's real degeneration of neurostriatal pathway. In Parkinsonism, we give medications which block the dopamine receptors. So that's the difference I wanted to emphasize between Parkinsonism and Parkinson's disease. It is when we treat patients for psychosis, we use common typical and atypical antipsychotics, which are dopamine blockers, which block the D2 receptors, like Seroquel, Zyprexa, Thorazine, Haldol, Prolexin. All these medicines we use in our practice, they lead to Parkinsonism. So that's the difference here. When we see people with Parkinson's disease, sometimes they can have psychotic symptoms. As we know, the treatment of Parkinson's disease is levodopa, which replenishes the dopamine. It is given with levodopa and carbidopa. Carbidopa is an enzyme which blocks the peripheral blockage of dopamine, leading to more central activity of dopa, where the deficiency of dopamine is. So when these patients are given levodopa, they have excessive dopamine, and these patients I see in my practice, having psychotic symptoms. So in these patients, they can have hallucinations, they can have delusions, they mostly have visual hallucinations. I see, recently also I saw a patient who was on levodopa. The medication trade name is Cenemet. I saw this patient, and this patient came to me with hallucinations and delusions and visual hallucination, and she was on this medicine. So what I did is I cut her dose, tapered dose, and that led to disappearance of her psychotic symptoms.